Hello, this video is about the ENRICH Carolinas project, coaching birthing facilities toward equitable maternity care practices. ENRICH Carolinas has an overarching goal of improved health outcomes through increased use of human milk. A more specific aim is to increase the number of births in North and South Carolina occurring in facilities working to improve maternity care practices through the Baby Friendly Hospital Initiative or a similar state-level recognition program. The ENRICH Carolinas team spans two organizations, the Carolina Global Breastfeeding Institute at the UNC Chapel Hill, and a national nonprofit, Population Health Improvement Partners, who are the quality improvement and data experts in this collaboration. I'll talk more about Baby Friendly as a framework for our improvement efforts and also elaborate on the important yet often overlooked link between maternal health outcomes and lactation. And then I'll share specifics on what we have done through ENRICH. The Baby Friendly Hospital Initiative is a healthcare improvement policy launched by the WHO and UNICEF in 1991 in an effort to increase global rates of human milk feeding. So hospitals who achieve this designation must adhere to the 10 steps to successful breastfeeding, which are evidence-based maternity care practices, primarily for the immediate postpartum period. And together, those 10 steps are intended to enable a family to provide human milk to their infant if that is what they choose. So currently, there are 20,000 facilities in the world with this designation. And in the US, just over a quarter of our births take place in baby-friendly designated facilities. A 2018 ARC comparative effectiveness review looked specifically at breastfeeding programs and policies, breastfeeding uptake, and maternal health outcomes in developed countries. The researchers concluded a lot of things, but the two highlighted here elucidate the importance of the ENRICH Carolinas project and those like it for impacting maternal health. The research supported previous literature findings related to the BFHI increasing breastfeeding duration and exclusivity, and it confirmed the association of breastfeeding with the reduced risk of breast cancer, ovarian cancer, hypertension, and type 2 diabetes. So next, we will share a short video on the ENRICH Carolinas project.
When someone comes to the hospital, something is usually wrong. But when you come to labor and delivery, something is right. You're getting ready to give birth.
I hold the hands of the hospital team and guide them through the baby-friendly process or North Carolina maternity care designation process.
If it hadn't been for this project, I don't think we could have made it to our designation. I mean, it was everything to us. They gave us the framework basically to make it possible. It's changed our hospital, it's changed our culture, it's changing our community. I mean, we owe so much to them.
Okay. As you saw in the video, we work directly with the staff at the birthing facilities. The maternity care practice improvement part of this project, or that yellow area, is definitely our primary focus. But in addition to that, we're able to provide birthing facilities technical assistance and support for areas of influence beyond the hospital walls that include both prenatal and postpartum touch points. The LIFE initiative stands for lactation and infant feeding in emergencies. This expertise has been especially helpful for facilities responding to hurricanes, floods, or other natural disasters, and of course, the COVID-19 pandemic and the recent infant formula shortage. A little bit about our approach. Each birthing facility is paired with a coaching dyad consisting of one expert in lactation and one expert in quality improvement from our team. And the coaches work one-on-one with small teams from each facility to create unique improvement plans involving data collection. Integral to our approach is helping birthing facilities become more equitable in the care they provide. We achieve this through our one-on-one coaching, where questions are continually asked that help teams begin to view those clinical topics being discussed through an equity lens. Through our webinars featuring guest speakers with lived experience or expertise in this area, we are creating space for our participating teams to continue their process of learning and self-reflection. And finally, we provide technical assistance to help hospitals understand that patient level data when it's disaggregated by race, ethnicity. And then we continue those conversations about what can be done for improvement. Our team developed a set of measures relevant to the project, and we coach teams to collect that data, and we coach them to collect it by race, ethnicity as well. They're also able to have a visual that helps them see progress or explore progress over time. And then each of those data points can be viewed by race, ethnicity as well. We do think our coaching is taking effect. We have observed an increase in the rates of ever and exclusive breastfeeding for African Americans compared with white birthing parents. And while we do recognize that using the white race as the referent group is problematic, since it assumes the white race percentage is some gold standard that it's not, we are definitely encouraged to see that the 23% disparity that you see here in our baseline data is getting smaller. We have also surveyed our birthing facilities working with us about whether their organization has a dedicated DEI department or position, and whether staff in their department have undergone any required inclusive excellence or DEI training in the last 12 months. And we will have some follow-up comparison to this data in the fall when we come together again for our annual Learning Collaborative meeting. So this summer, we have been lucky enough to have a public health graduate student working with us on the ENRICH Carolinas project, and we have asked her to share her experience with you.
Before I came to Gillings or even thought about public health or coming to grad school, something that really piqued my interest was equity considerations and thinking about what that looks like to implement in a clinical setting, especially within the context of maternal and child and family health. When I heard about kind of ENRICH Carolinas' mission and the project itself, working with prenatal clinics and hospitals and looking at the health system as a whole, being able to cater to one individual's experience, I was so excited. One thing that I have learned so far that has been really valuable to me as a student and someone new to public health is understanding kind of the relationships that you need to build with people and with hospitals and prenatal clinics. Again, a lot of people talk about equity as this big kind of overarching theme, but I think at the end of the day, it really is, how do you connect with people and how do you listen to people really well? Yeah, that's been something I've learned and have seen modeled while I've been working in this project.
All right. I thank Rebecca for sharing her experience, and just close with a couple slides on how you all can find and support similar initiatives in your area. So if you happen to be affiliated with a hospital that provides births, you can show your support by asking questions. So has your facility ever achieved baby-friendly designation or a similar state recognition for implementing the 10 steps to successful breastfeeding? Is there any training or support offered to staff to help them learn about implicit bias in healthcare or equity in maternity care? Does your facility collect maternity care data by race, ethnicity? Who's looking at that data? What's being done? Asking those questions. And then for other advocates, I'd recommend starting with the state breastfeeding coordinator at the state health department. They should be a real excellent resource and can share whether your state is one of the more than 40 states who do have a recognition program for hospitals modeled on the 10 steps to successful breastfeeding. And they may also have federal grant funds that support human milk feeding. So ask how you can support these initiatives, spread the word about them, or otherwise get involved in this impactful work for maternal health. There's a few other things on this slide you can check out. We invite you to look and see what's going on in your area. Appreciate your interest in this video and invite any of your feedback via email. And thank you. Thank you again.